but you're very passionate about understanding the voice of customer. And now you're the lead to market a product where you have been that customer, the end receiver, the patient who receives that testing. How did that affect your perspective now sitting in the marketing and sales arm of this product, knowing that you're trying to reach those clinicians, many of which may not know about genetic testing? They may know about BRCA, they don't know about expanded testing, and the importance of your role at the time to expand awareness to get the test to the people who needed it.
I think when I got there, I was really surprised at the number of clinicians who do not offer genetic testing to their cancer patients. It was mind blowing to me, to be totally frank.
This is Genetics for Healthcare, a podcast for patients.
Thank you for joining another episode of Genetics for Healthcare, podcast dedicated to helping patients and their loved ones advocate for a precision medicine approach to treatment, disease screening, and prevention. You can find us on Spotify, Apple Podcast, LinkedIn, YouTube, Facebook, and Instagram. Be sure to hit that subscribe button on YouTube to get alerts and updates on incredible new episodes like this one. Today we have Caroline Massey Yost, breast cancer survivor, marketing and communications leader, and she's going to share with us her journey with breast cancer and how this led to her executing a larger vision that expanded the awareness and the uptake of hereditary cancer testing. Caroline, thank you for being a guest on Genetics for Healthcare.
Thank you. I'm really excited to be here.
Before we get into your story, I want to ask you about your experience with your mother's breast cancer diagnosis, because it seems that's when you started to learn and advocate even for yourself for approach to long-term health and early detection. How did your mother's diagnosis impact your family, and kind of what was your mindset at that time?
Yeah, so my mom was diagnosed with breast cancer in 2008, and one of one of the things that she really struggled with was whether to do a single or a double mastectomy. So she had cancer in one breast, and she really didn't want to lose her other breast, and so she really struggled with that decision. And eventually, the testing came back that she had like an 80% chance of developing breast cancer in the other breast. So she, at that time, decided to do a double mastectomy. And during this whole process, I was kind of walking through that journey with her as she struggled, and then finally made that decision. And so I made the decision then, if I'm ever diagnosed with breast cancer, just take them both. Like, I don't want to worry about it. I'm going to get a double mastectomy. No, no doubt. And so for me, I didn't expect, I mean, I kind of thought, well, maybe one day I'll get breast cancer, but I hadn't really thought it through for real. But I did make that decision when she was diagnosed. Yeah. So I started going at that point to her breast specialist, which, so it changed the course of my monitoring. So I wasn't just going to get a mammogram at my OBGYNs. I was going to a breast specialist, and they do a mammogram and an ultrasound as part of their screening. So I don't know if you want me to go ahead and just keep going from there, or if you want to ask another question. But that was kind of the beginning of how it shifted my plan.
Yeah. Um, well, go ahead and tell us about like that time, because these were the early days of hereditary genetic testing, and it was, the Angelina Jolie effect with BRCA, I believe,
Hmm.
in those days, but it wasn't very well adopted. There were still um, limited payer coverage for hereditary cancer testing, but go ahead and tell us about the visit that led to your diagnosis, because at that time you were routinely getting, annual screenings, right?
Yeah. So, yeah, my mom did not have any genetic testing done in 2008. She had her surgeries and all of that. It when I started going to her breast specialist. I was monitored with a mammogram and an ultrasound There were actually a few years where I didn't have great insurance, so I skipped a year going and always kinda did it with trepidation, but just thought, I'm being really careful. If I skip a year, it's gonna be fine." Well, I'm grateful that in 2018, I didn't skip that year. I'm also grateful that I was going to a breast specialist because of my mom's family, because of my family history, because my mom had breast cancer, because the mammogram missed it. It did not get it. It was the ultrasonographer. The ultrasound picked it up.
Wow.
And so if I had waited a year or was just getting mammograms, if it had been another year before it was, you know, a problem enough for a mammogram to pick it up or for, to feel a lump, my story could have been very different.
Obviously, it was a sharp practice. You had the tech that was running the sonogram who flagged it, and that precipitated the whole diagnostic workup that led to it. Um, did they recommend genetic testing at that time?
So not quite yet. So so my appointment was I actually went back and looked on my calendar before we were talking so I could kind of remember it because I had some dates in my mind. But my appointment was on a Friday and I was leaving on Tuesday to meet my husband in Colorado because he was out there for a big project and I was going to be out there for like a month or two. I don't even remember how long. And so my doctor said, there's something a little funny in the ultrasound, and I'd like to do a biopsy. And I said, okay, can I do it when I get back from Colorado? She said, nope.
Okay.
And she did the biopsy while I was in the office. And she told me it would take about a week to get the results and probably nothing to be concerned about, probably a cyst. And so Monday night, I got home from work and my phone rings and it's my doctor. And she says, "You have breast cancer." And I was like, "Oh, okay." And she said, you could probably have a lumpectomy." And I stopped her in her tracks and just said, "Will insurance pay for a double mastectomy?" And she said, "Yes." And I said, "That's what I want to do." And she said, "Okay."
Yeah.
And yeah, so it was in that conversation where she said, I'm also going to recommend that you do genetic testing. I recommend that you do the STAT test, the quick test that would test 9 genes, what she called the kind of the big scary genes, like you mentioned. BRCA1 and 2 are in that STAT panel. She said, I want you to do that because we get the results back quickly and we can kind of see what we're dealing with. But I also recommend that you strongly consider doing a wide panel but especially because of your family history, a wide panel of genes to see if there's anything else, anything going on that, we might not. I said that very badly. She recommended that I do a full panel of genetic screening to see what else might be going on with my genetic markers.
Yeah.
Still not saying that very well, but
Well, I think you're painting a great picture for our listeners because the experience of some, and this, is no one recommends that type of testing. You get a biopsy. Sometimes then you're referred to, oncology or radiology. They go through the surgical management, some radiation, and even the therapy, drug therapy management, which would be by an oncologist, a breast oncologist. But it's the experience of many cancer patients that they don't have that consult about getting some type of genetic test, which has therapy implications, which has surgical implications, and it has implications for their family members. So, in this time period where you had a biopsy, you um, were doing your testing for your stat genes, what was your mindset about the expanded panel? Were you excited to do that, or was there a little hesitation on that?
there was a lot of hesitation. The stat was no brainer to me. Like, okay, definitely do it. But I had to talk to my husband about it, and we just really talked it through. Like this would be scary to know. And as we talked, I we finally kind of came to the conclusion that I, look back at was an obvious decision, but power is knowledge. And if there's a chance that I have a genetic variation that is actionable, why wouldn't I want to know? Because the whole thing with cancer is catch it early or prevent it. And so, I look back at that whole time and my poor husband, because this was actually something as I was thinking about this podcast that I didn't very think through very well because I had already made up my mind in 2008 that if I ever was told I had breast cancer, I was going to get a double mastectomy. When I was diagnosed, I literally called my husband and was like, Jim, well, it's cancer and I'm having a double mastectomy. And I had convinced him, just like I had convinced myself, that it was a cyst. So he was completely flabbergasted and
Yeah.
and scared and way more. And I look back at it now and I wish I had had a little more sensitivity to what it was like for him. But I was so glad that I had him as a partner to think through, do I want to know this big panel? And yeah, so I did end up doing it, and I'm very glad I did because I did have something that popped up.
So, okay, let's stay there for a while because what I found that's interesting, and you shared your stories on many different platforms, including the Today Show, today.com online, and you talked about the trepidation you had for doing the larger panel. Do I really want to know? But it speaks to the importance of our support circle, whether it's a loved one or a trusted individual, to air out those things, air out those fears, and help us to advocate for ourselves, have conversations with our care providers. And I also want to point out too that there are many patients in that same position of being diagnosed that are not counseled or sent out to a genetic counselor for counseling, because many clinicians may know of BRCA, but they don't know about like multi genes or the many other genes that could make a patient high risk. So, what did you understand about the smaller single gene or a stat versus the comprehensive panel back then? What did you learn that made you go through with the comprehensive gene panel?
Well, I guess, Dr. Google. I just got I got on the internet and was trying to understand what was on the panel, what they might mean. I Beyond my mom, and this was the main thing, is beyond my mom, we do have other cancers in my family. Her dad had colon cancer, for instance, and her sister has had breast cancer, and my dad's mom had breast cancer. So I knew that there were some funny things going on in my family, and it just made sense to know. And if, like I said before, if there's something that I can learn where I can take some action to prevent or catch something early, it just made sense. Um,
Yeah.
yeah. So I did meet with a genetic counselor. So that was part of my my journey was meeting with a genetic counselor, and she once I got the results. So I don't know if you want to jump into that yet or not.
Well, I mean, yeah, let's jump into it because I think it's important that you got genetic counseling early. A lot of times that may be, put off until certain treatments are made, but it can have significant implications, therapy implications. But also, as you mentioned, as you're going through it, it gives you an opportunity to talk with your family about the results of those and how it may uh, impact their health care long term. So let's talk about the results and kind of what drove your decisions for care.
So when the panel came back, I had a positive in a gene that's called PMS2. It's tied to Lynch syndrome. I had never heard of any of this at the time. Met with a genetic counselor and learned that I had an increased chance of cancer in colon cancer, which made sense with my grandfather having it, ovarian, uterine, stomach, bladder, all these things. And so she recommended that I consult with what is she called? An gyneconc,
Mhm.
a
Gynecologic
gynecologic
oncologist, yeah.
oncologist. And I met with her, and she recommended that I have a total prophylactic hysterectomy. I was finished having children, and to me, I was like, "Well, I don't need these organs anymore, so let's get them out." And so, yeah, so over the course of 2 years, I had 5 surgeries between a mastectomy and reconstruction and a total hysterectomy and some issues all in there. Yeah, I had 5 surgeries, so I personally feel like I mean, some people would say 5 surgeries is horrible, but I feel like I got off easy because I did not have to we did catch it early enough. I did not have to do chemo. I did not have to do radiation. So I feel very blessed that that was that was part of my story too. Um, kind of feel guilty when I talk about being a breast cancer survivor because we we did catch it so early, and I really, to me, 5 surgeries is nothing compared to that other stuff. So
I appreciate I appreciate your vulnerability and even sharing that. Um, how did those test results affect your outlook or resolve to be an advocate for others in your family to be tested?
well, we did the cascade testing. Um, so my we went backwards to my mom since that seemed to be the logical place that this was coming from, and she was the one. The PMS2 did come from her. Um, we tested all of my children. I have 3 children, and they were all negative. So I feel very fortunate for that they don't have to worry about that. And it went beyond my family though. So I that was when I became an advocate for genetic testing in general. Um I was advocating and proselytizing about genetic testing to anybody who would listen at that point. My friends, anytime I heard about somebody, a friend of a friend who has cancer, I was like, please just ask them if they've had genetic testing, make sure they do it. I mean, I didn't, it wasn't like on social media or anything, but anywhere, like in my sphere, I was at that point very much promoting getting genetic testing. I mean, in my opinion, this is how strongly I feel about it. I believe that this should be part a standard of care. You go to the doctor once in your life, you get genetic testing, they have this done, and you can be, and not just for cancer. I mean, there's all kinds of conditions that you can test for because it's all about so many of these conditions are about prevention or catching things early. And so, yeah, I became a proponent of this long before I started working for the company that did my testing.
Okay, so that's an interesting story. So in a twist of fate, because you started your career in education, then you built your own marketing and communications firm. Did you see this in your future? The very company that did your genetic testing, you actually became the lead for oncology and their portfolio of tests. Like, tell us about that.
Yeah. So when I was diagnosed at that time, I had my own marketing company, and the segue was I was in education. I needed to make more money. I went into sales. I kind of consistently found myself in roles where my colleagues were coming to me and asking for guidance and how to build their businesses and their kind of book of business. And a friend of mine one day said, "You should just start your own marketing company. You're already helping people grow their businesses." And so that was how I did that. That's how I went from, there was a step in there, but between education and marketing. So when I was diagnosed, it was my when I had my own company. Uh, one of my clients was actually my dad, who is a fertility doctor in
Hmm.
Atlanta, and it was kind of during this time, and actually kind of in the middle of all my surgeries, he was diagnosed with cancer too. He
Wow.
had both bladder and kidney cancer. So that was a whole journey in the middle of all that. But because I was in the fertility world, I ended up actually going and working for him full time. But I was around a lot of genetic testing for carrier testing and things like this, just a kind of a different take on, a different angle on genetic testing. And one of the companies that we used there too was also the company that did my genetic testing. So it was like this like all these things were pointing to the company that I ended up working for. When I decided to look for a new job, I I decided I really realized at that point in my life that I was very mission driven, and I really feel passionate about genetic testing. And there was a role at Invitae that was a women's health marketing lead, and I was like, wow. Well, this is perfect because I
Right.
was in the women's health world with fertility, and I was fortunate enough to get that role. Ended up transferring into the oncology marketing lead shortly after I got there, and that was where just it was amazing. I literally woke up every day getting paid to to do what I was passionate about.
Isn't that incredible?
So, yeah, it was pretty awesome.
In your marketing career, she's a great follow on LinkedIn, by the way. We'll give you her contact information if you want to reach out to Caroline. But you wrote an article about how the voice of the customer, seeking the voice of the customer, is a superpower in business. And just kind of to tell the folks out there, we worked together at Invite, and so I saw your level of excellence firsthand. But you're very passionate about understanding the voice of customer, and now you're the lead to market a product where you have been that customer, the end receiver, the patient who receives that testing. How did that affect your perspective now sitting in the marketing and sales arm of this product, knowing that you're trying to reach those clinicians, many of which may not know about genetic testing. They may know about BRCA, they don't know about expanded testing, and the importance of your role at the time to expand awareness to get the test to the people who needed it.
That's a really interesting question, Jerome, because I think when I got there, I was really surprised at the number of clinicians who do not offer genetic testing to their cancer patients. It was mind-blowing to me, to be totally frank. Obviously, the genetic counselors get it. That's their world. But the oncologists, it's not what they were trained in, right?
Yeah,
Genetics is so recent. So unless they graduated within the past 5 years, they weren't trained on anything, 0 about genetics. And so I had to kind of like get into that mindset of, how do we communicate with oncologists without making them not trying to make them feel stupid because you're just going to make them mad.
yeah,
Don't want to ever do that, but how to communicate them with it because they do want the best for their patients, and how to present information, how to provide our sales team with information that they can go in and help to educate them in a way that is non-threatening, that is just helpful. And yeah, I mean the end user is the patient, which I totally understood that perspective, but our audience was actually the oncologists. And really understanding kind of what were the blockers for them. They want to spend time with their patients, but do they have another 10 minutes to explain genetic testing to their patients? Like all of these blockers, and trying to, one of the big goals was just to figure out ways to make this testing accessible for them, easy for their teams. And, and that's part of why, it went beyond just marketing. We really had to collaborate across the board because it was the sales team had to be equipped with the tools to do that and the talking points to do that. And yeah, so it was interesting, and just kind of on that note, and I think I mentioned this to you recently, I I don't remember if I did or not, but just recently a friend of mine was diagnosed with breast cancer, and I said, "Please be sure that you get genetic testing." And she asked for genetic testing in her next appointment, and the doctor said, "Oh, you don't need that."
Mm.
I literally almost blew a gasket. I was so mad. I was so upset that this is a doctor who has my friend's life in their hands and they're
Yeah.
telling them that they don't need genetic testing. So I literally got online and I went and I copied the guideline and the link and I sent it to her and I said, "You bring this into your next doctor's appointment and tell them to please do genetic testing. Don't ask if they think they you need it. Tell them you need it." And that's something that I feel like is a balancing act as way beyond when I worked at Invitae, but just when I am trying to kind of coach my friends or my family and advocating for themselves. If a doctor doesn't think you need something, but you know you do, how to have that conversation and request it firmly and get what you need, even if they don't think you need it. And if they won't do it, there's patient pay prices out there. There's other doctors who like find a way to do it. So yeah,
That's
that
the
was a
importance of
side
this
note.
podcast. This is why we do it. We've talked about this before, is how can we empower patients with the information, the language, and the confidence to go in where, and as you mentioned, all physicians have the best interest of their patient in mind. We know they're busy. We know this information, especially in the world of genetics and genomics, moves very, very quickly. So it's hard for the clinician who's seeing multiple patients a day to kind of keep up with the data. But it's vitally important that we're able to educate, equip ourselves with the questions and the information to have the dialogue with your physicians or your treating clinicians to get access to things like this. And one of the things that you were thinking about when we were working on this problem of how do we increase access, how do we, reach those doctors who are seeing everyday breast cancer patients who the guidelines say should be offered germline genetic testing, but they're not, or maybe they're just only offering BRC BRCA1 and 2. And if this was, your case, you would have missed the pathogenic variant that was inherited and that might cause issues in healthcare long term. But talk about how you went to attack that problem from a marketing and a communication standpoint with targeting that audience of oncologists, cancer treating clinicians, to raise awareness and the results of the campaigns that you created.
Yeah, well, we had fun with one. Well, one thing that you just said that just audience wise that I kind of realized when we were working with oncologists, you just used a word that we actually decided not to use in marketing, which is germline. They have no idea what germline is. So the GCs, the genetic counselors do, but that was like an example of understanding our audience when we were talking to the oncologist. We did use like simplified hereditary explained what germline is,
Right.
hereditary cancer genetic testing.
And you went out and got that information from that target audience.
Mhm, mhm. Yeah, so we kind of just decided to have a little fun. Every October is Breast Cancer Awareness Month, and we kind of changed it up a little bit and made it Breast Cancer Action Month. And not that awareness isn't important, but we created several kind of tools and things that the sales team could use to go into the offices and talk to the doctors and the teams about taking action. And the guidelines for breast cancer are clear. And we what we did, and I don't know how much they actually did this, but we suggested that the salespeople kind of do a month long challenge with their doctors to just for 1 month, for the month of October, take action and test every single breast cancer patient that comes in. And we did pins, and I just found out I talked with Holly the other day, and she still wears her breast cancer action um, pin. She's not even with the company anymore, and she still is wearing it. So
Still effective.
yeah, so that made me very happy when she told me that. But yeah, so we just kind of turned Breast Cancer Action Month on its head and said, I mean, we turned Breast Cancer Awareness Month on its head and tried to get folks to think about taking action.
Yeah. The reason why that's important, and again, in this context, we were talking about cancer treating physicians when patients have a cancer diagnosis, and there are at least 5 tumor types where germline genetic testing is indicated, and that is breast, ovarian, pancreatic cancer, um, prostate cancer, colon and rectal cancer, and they're changing all the time. So we hope to keep information updated. But as you said, it's really about action. Awareness is fine, and I had a great guest, Kathy Baker, with My
Kathy,
Faulty Gene,
she's
and
awesome.
she is so awesome. She said, information is not power until it's acted upon, right? So applied information is powerful. Information itself is not as powerful. But what we want to do is empower our listeners. We're really about action. This is everything that you just mentioned. I love the idea of, breast cancer awareness, and you flipping that and saying breast cancer action and really challenging clinicians. And here on Genetics for Healthcare, we want to empower and inform patients. So, what are some practical tips or questions possibly that they can ask their care provider to advocate for themselves to get access to this type of testing and information that can have implications for their long-term health and also for the health of their loved ones?
Yeah, well, the first thing I would recommend is ask for genetic testing. If you have a personal or even a family history, and when I say family history, beyond breast cancer, so I think I'm afraid that a lot of people think, oh, I forgot that Aunt Judy had
That's right.
something that they didn't really talk about, but she died young and it wasn't a heart attack. So I think, you know, talking to your family and understanding truly what that family history is, but then requesting it from your doctor and really kind of posing that as, do you not as, do you think I should have genetic testing, but if you know you should because you have a personal or a family history of it, just request it. And if they don't know how to do that, find a way to get it done, either through another doctor or find a company that does have a patient pay way to do it.
Yeah,
It's not that
absolutely.
expensive.
And it's not that we're here to direct anybody to any one company. There's lots of
Oh,
companies
right.
that do
I
that,
don't care
but
where you go.
yeah, reach out to them, and many of those companies have assistance programs or can get in touch with a clinician or a genetic counselor to help you if that's what you desire. So the first point is well taken. Ask for it,
Yeah.
and not just ask, demand, because you may have a clinician who says, well, you know, I'm not going to use it or it won't help you. You're the patient,
Yeah.
and you can ask, and it provides a lot of information. Sorry, I didn't mean to step on you
Yeah.
there.
No,
Go
no,
ahead.
no. That's good. And I kind of touched on this, but I think the second thing that I would like my tip or whatever would be um, talk to your family about your family history. It really is taboo in a lot of families to talk about. And some of this is generational. Like my dad's family just didn't talk about health stuff. So I really had to kind of pry. And when I found out that his mom had breast cancer, it hadn't been talked about before. So if I hadn't asked, I wouldn't have known. So yeah, so that would be the next thing is to to do the research, talk to your family, and don't. It's not a taboo thing. It's okay to talk about, and it's important to talk about.
Yeah. And I just want to add on there. A lot of times when we think about family history, and I've had these conversations with other cancer patients and survivors, they think the family history is mom, dad, sister, brother. right? And so they'll say, "Well, I don't have a family history. It's like my grandmother passed away. We don't really know," or my aunt, my mother's sister, had breast cancer. Well, that is still family history. First, second degree relatives. First being mom, dad, sister, brother. Second, cousin, uncle. Uh, it's all relative. So it's important to understand and have these conversations. And we understand they can be tough because for generations, there are families who don't talk about those things. And so, the more information you have, the more information you can share with your clinicians that may unlock access to innovative therapies or tests that can help you.
Mhm. Yeah, and I guess the third one, I feel like I'm kind of repeating myself, but just be proactive. Give yourself permission to advocate for yourself and for your family. And, you know, s- a lot of doctors out there are so amazing at what they do and they are so collaborative. But there are doctors out there who have a lot of ego and they're harder to talk to and they're harder to kind of have a conversation with. And I just really encourage people to have the gumption or to have enough confidence that it's okay to advocate for yourself and to ask questions. And if you get shot down because you're asking questions, you need to find another doctor. Like, there's lots of good doctors out there, but it's okay. And it's important to do. And I find myself right now in this role again because my mom, so back to my mom. So she was actually, I don't know if you want to go into all this, but my mom was actually just diagnosed with metastatic breast cancer.
So
And
that's a recurrence
this is
after.
a
Oh yeah.
recurrence.
Okay.
So when in 2008, they got it all with her mastectomy, she went through her therapies and everything, graduated from her oncologist, and has been fine for years. And now, whatever, 15 years later, I guess since she finished her therapies, it's probably been 10, 12, but it's in her bones. And so now I'm I'm advocating for her. And another thing, I guess, in the advocating part is if you have a family member who has cancer, go with them to the doctor's appointments. If you're the
Absolutely.
patient, bring someone with you to the doctor's appointments because it is so much information. And as soon as they say one thing, your mind starts like latching onto that. You can't hear anything else as a patient. And so it's really important to have someone advocating for you and with you in your appointments. I mean, this thing with my mom now has scared me because I've graduated from my oncologist. They got it all. And so I actually just made an appointment to piggyback on one of her appointments in May to talk to her. She's now with a new oncologist from when we had before our oncologist retired. But I'm going to consult with this doctor too because I want to know, is there anything I can be doing to monitor me more closely since I don't go to my oncologist anymore. I graduated. What do we need to be doing for me so I don't get bone cancer in 10 years? And I don't want that. So it kind of freaks me out. So I'm advocating for myself. I'm going to go to her doctor and see if there's anything that we can be do to me to do to monitor me more closely.
Caroline, you've got an incredible story. You've made an incredible impact in a very short period of time on helping. As the guidelines have expanded, you've raised the awareness of cancer treating physicians and the clinicians to take on the uptake of this type of testing, hereditary cancer testing, and the implications, helping the market understand. And you've made a tremendous impact professionally. And I sincerely appreciate you sharing your story here on the podcast because I know that your story is going to empower other patients and other family members to seek the same access to this
I hope so.
information for themselves.
Yeah, I hope so. Well,
Yeah.
it's weird to talk about all this publicly, but it is important, and I'm proud to help spread the word because if we can just I've talked to a lot of people when I was on these other kind of programs before. People heard me and reached out to me, and there's a lot of people who had genetic testing because they heard my story, and so if I can impact
Yes.
one person, it makes me so happy to have spent this time with you.
Awesome. So it gives you more time. I understand your favorite pastime is fishing.
Yes. My husband and I live on a lake, on Lake Lanier, just north of Atlanta, and we love to fish and anything outdoors, archery. Yeah, our dog keeps us pretty busy outside. So,
That's awesome.
yeah.
What you catching out there on Lake Lanier, by the way?
Well, if you look behind me, you can see a picture. That's a striper. That's my husband and my dog right there, but that's a striper right there. On this other wall, you can't see it, but that's a big snook that I caught in Florida.
Nice.
So, yeah, it's pretty fun.
Yeah, we got some serious fishers. I grew up in small town Texas, and we grew up on a lake, and we just stick pole in whatever we
Yeah,
caught,
yeah.
crappie,
A lot of
catfish, whatever.
catfish here. Yeah.
I got it. Good eating, but
Yeah.
that was then. It's you're a big game hunter when it comes to
Well,
fishing.
we've caught plenty of catfish too.
Awesome. Caroline Massey Yost, thank you so much for being a guest on Genetics for Healthcare.
Thank you.